Hi everybody, today we are going over part 2 of your eyelash extension written exam. This is the infection control chapter. So I'm going to share my screen. So again, this is that same document that we were looking at last time. This is, again, where you'll find all your written information. And if you can't remember how to get to this video or this section, you'll type into PSI, click on the examination information, click on the eyelash section, and then you will be here. Scroll down to page 13, and then you will be right where we're at right now. So this is that second section. If you are taking your exam before August 31st, you'll still be on the left side. If you're taking it after that point, you'll be on the right side of the screen. So this section has 15 to 13 questions. It is the second largest section of your exam. The only larger section will be your eyelash application and removal section, which has 15 questions. So the topics covered in this section are cleaning and disinfecting your implements, your environment, and your work equipment, as well as the safety procedures of exposure incidents, patch test, and the skin and eye diseases and disorders. You are going to be able to find that information on those sections in your TDLR, PSI, cosmetology, rule and law book, like we talked about in part 1, as well as your CEO book. And those chapters will be chapter 6 again, which is the safety, sanitation, and infection control. Chapter 7, which is your disorders and diseases. And chapter 8, your protocols and procedures. So if we're looking at the cleaning and disinfecting our work implements, the first section we're going to go over will be in your TDLR rule and law book. And that will be section 83.102. In your rule and law book, if you still have the 2020 edition, that will be on page 87. We're going to skip back a little bit and go to page 85 for section 83.100. This is the health and safety definitions. The reason that we're skipping back to this one is because in this section, it tells you some following definition terms that you need to know. So chlorine bleach solutions, which is a chemical used to destroy bacteria and to disinfect implements and non-porous surfaces. The solution should be mixed at least once per day and used in this chapter. As used in this chapter, chlorine bleach solutions fall into 3 categories that are based on the concentration and the exposure time. So how long you're going to leave that solution on that surface. So for your low-level disinfections, you're going to add 2 teaspoons of household bleach to 1 gallon of water, and you'll soak it for a total of 10 minutes. For a high-level disinfection, you'll add 1/3 cup of bleach to 1 gallon of water. And that one you'll let sit for 20 minutes. So you're adding more bleach and more water. Well, the same amount of water, more bleach and a longer setting time. So this one is 1/3 of a cup and for 20 minutes. The next one is blood and bodily fluid cleanup and disinfection. This one you will add a cup and 3/4. So 1 full cup and then 3/4 of a cup of household bleach to 1 gallon of water. This is a 10% bleach solution, and this will get left on for 10 to 20 minutes. That one will only really be used on your tweezers and something like that that will actually get blood and bodily fluids on it. Your low-level disinfection, that will be for surfaces that mainly you touch, your countertops, things like that. And then your high-level infection is anything that you and your client touched but did not get exposed to blood or bodily fluids, such as your bedding, things like that. The difference between cleaning, disinfecting, and sterilizing and sanitizing. So cleaning is washing with liquid soap and water, detergent, antiseptics, or other adequate methods of removing all visible debris or residue. Cleaning is not disinfection. Cleaning has to be done first, and that is to remove physical, visual debris. Disinfection or disinfect, to use a chemical to destroy pathogens on implements or other hard, non-porous surfaces to render an item safe for handling, use, and disposal. So this one is not for physical debris. You've already gotten rid of the physical debris when you cleaned it, and now you're getting rid of those pathogens that you cannot see. Any disinfectant that you use in your salon, lash studio, whatever it is, has to be approved by EPA. Then you have sterilize. Sterilize is to eliminate all forms of bacteria or other microorganisms by use of autoclave or a heat sterilizer. This can also be done by that bleach solution. So this is the highest form of cleaning. Once you've cleaned it, you will either choose whether it needs to be disinfected or whether it needs to be sterilized. If it gets used on the person, punctures their skin, anything like that, it needs to be sterilized. Sanitized or sanitization, to reduce the number of microorganisms to a safe level by using an ultraviolet sanitizer. So that is like when you're at the school and after you have your tweezers in the barbicide, then we put them in the UV light sanitizer to clean them the rest of the way and make them as clean as possible. The difference between multi-use and single items. Multi-use items are constructed of hard materials with a smooth surface, such as metal, glass, or plastic. They are typically used on more than one client, but have to get washed in between each client. These are not limited to, but do include clippers, scissors, combs, nippers, tweezers, and nail files, depending on what your nail file is made out of. So mainly for eyelash artists, it will be your tweezers. Those are your really main multiple use items. You can have your lash fan, your nano mister, as well as your hand fan and your mirror that you use under the eye. Those will be your multi-use items. Single-use items are porous items made or constructed of cloth, wood, or other absorbent materials that have a rough surface, usually intended for single use. So any item that you'll only use one time, like your cotton rounds, Essie wipes or 4x4s, your lash glue pads, under eye gel pads, things like that. Those are your single-use item as an eyelash artist. Section 83.101, this is the Health and Safety Standards Department approved disinfectants. So this is again saying everything has to be approved by EPA, the Environmental Protection Agency, as a registered product approved for cleaning or sanitizing, sterilizing, whatever you are needing to use it for. And it goes a little bit more in depth on what gets used where and how long it has to sit. So you can go and look into that to get a little bit more in-depth view on that section. The next section is section 83.102. This is the health and safety standards general requirements. So this is across the board how you have to clean and sterilize, sanitize your area, and how you have to maintain that safety in your business. So all licensees shall clean their hands with soap and water or use of hand sanitizer prior to performing any services as necessary during the service to include the client's health and safety. All cosmetology establishments and licensees shall utilize clean and disinfected equipment, tools, implements, and other supplies in accordance with this chapter, and shall employ good hygiene habits while providing cosmetology services. A licensee may not perform services on a client if the licensee has a reason to believe that the client has a contagious condition such as head lice, mites, ringworm, conjunctivitis, or inflamed, infected, broken, raised or swollen skin, or nail tissue, or an open wound or sore in the area to be serviced. So mainly you guys are worried about the skin of the face as well as the eye. So any contagious skin and eye diseases of that area, if they have it on their arm and their arm is slightly swollen, that doesn't really have to apply to you. Multi-use equipment, implements, tools, and materials not addressed in this chapter shall be cleaned and disinfected before use on each client, except as otherwise provided in this chapter. Chairs and dryers do not need to be disinfected prior to use for each client. Single-use equipment, implements, tools, or porous items are not addressed in this rule shall be discarded after a single use on a client. Some of these specifically go and actually do apply to you. Other ones don't, like shampoo bowls and manicure tables don't really apply to you. So you only have to worry about the ones that apply to you. The next section that we're going to skip to is a couple pages down. This is section 83.111, health and safety standards for blood and bodily fluids. Blood can carry many pathogens. For this reason, the licensee should never touch the client's open sore or wound. Powdered aluminum, septic powder, and cyanoacrylate, i.e. liquid type bandage, may be used to contract the skin and stop minor bleeding, and should be applied to the open area with disposable cotton-tipped instruments that immediately are discarded after application. In the case of a blood or bodily fluid contact on any surface area such as a table, chair, or floor, an EPA-registered hospital-grade disinfectant, a tuberculocidal disinfectant, or a 10% bleach solution, which again is that 1 cup and 3/4 cup of bleach to a gallon of water, shall be used per the manufacturer's instructions immediately to clean up all visible blood or bodily fluids. If any non-porous instrument is contacted with the blood or bodily fluid, it shall be immediately cleaned and disinfected using the EPA-registered hospital-grade disinfectant, a tuberculocidal disinfectant in accordance with the manufacturer's instructions, or total immersion in a 10% bleach solution for at least 5 minutes. If any porous instrument contacts blood or bodily fluid, it shall be immediately be double bagged and discarded in a closed trash container or biohazard box. This one is important because this one marks not only how to do the cleaning and disinfecting of this section, but also the health and safety procedures of how to deal with an exposure incident. So section 83.111 is a very important section for you guys to remember. Section 83.113, this is the health and safety standards of the FDA. All licensees shall not use any product in providing a service authorized under the act that is banned, deemed to be poisonous or unsafe by the United States Food and Drug Administration, the FDA, or other local, state, and federal government agencies responsible for making such determinations, mainly OSHA and EPA. Possession or storage on a licensed premises of any items banned that may be deemed poisonous or unsafe by the FDA or other governmental agencies shall be considered prima facie and evidence of its use. For this purpose of performing services authorized under the Act, no licensee shall buy, sell, or use or apply to any person liquid monochromatic methanol methacrylate, which is MMA. Not that I think any of you guys will have that issue. So those ones are the ones that we're going to pull out of here. The last one that we're going to pull out of this book is section 83.115. This is the health and safety standards for eyelash extension application. So this is how specifically health and safety standards apply to you as an eyelash professional. So a licensee offering the eyelash extension application service shall wash his or her hands with soap and water prior to performing any service on a client. Equipment, implements, and materials shall be properly cleaned and disinfected prior to providing services. Chairs, beds, and including headrests shall all be cleaned and disinfected after providing the service to each client. The chair and bed shall be made or covered in a non-porous material that can be disinfected. After each client, the following implements shall be cleaned and disinfected: tweezers, nasal aspirator, or electric eyelash dryer, or other items to be used for similar purposes. The following implements are single-use items and shall be discarded in a trash receptacle after each use: disposable gloves, tissues, disposable wipes, fabric strips, surgical tape, iPads, extensions, cotton rounds, cotton swabs, face mask, brushes, extension pads, and other items for use of a similar purpose. The following items that are used during this service shall be replaced with clean items for each client: disposable and terry cloth towels, hair caps, headbands, brushes, gowns, spatulas that contact the skin or products from a multi-use container. And a licensee shall use only properly labeled semi-permanent glue and a semi-permanent glue remover that must be used in accordance to the manufacturer's instructions. Extensions must be stored in a steel bag or covered container and shall be kept in a clean and dry, debris-free storage area. So that's specifically, all the other ones apply to everybody on a general basis, but that last one that I read applies specifically to you as eyelash extensions. And again, that section is section 83.115. The other ones are in your eyelash textbook, and they are chapter 6, chapter 7, and chapter 8. So if we go over to chapter 6, chapter 6 is the safety, sanitation, and infection control section. This chapter goes over what is safety, the importance of hygiene, why protecting yourself and your client's manners, infection control theory, as well as procedures, sanitation for public and personal health and safety, treatment room supplies, disposables, and products, after the service decontamination procedures, sanitation, infection control, as well as some fun facts. So those ones we mainly already covered in this chapter that we were going over earlier, but just to give you a little bit more in-depth of a reading on that topic, figuring out what a contraindication is, figuring out an infection. Is it from a virus? Is it from a somebody touching a doorknob? Is it from somebody breathing on you? How that happened and how to prevent it. That is the main part of infection control, is to break that chain of infection, to make it to where it cannot spread to another person. The next section will be diseases and disorders. This is chapter 7. Chapter 7 goes over the common eye disorders, common diseases, contraindications, what to say and what not to say, and why we need to be informed. So as eyelash professionals, again, you've already been through these chapters, so this is a review to help you jog your memory. So as eyelash professionals, our job is to make sure that we are as clean and sanitary with every one of our clients that walks in our door. We need to be aware of what risks that could occur. So what diseases are contagious, what diseases are not contagious, what ones will affect that service that we're performing on that client. As eyelash professionals, we are not licensed to tell them that they have any skin disease, disorder, or condition. We are not doctors. We do not have that ability. So whenever it comes up as something that needs to be addressed, again, we're going to go over it the same way that we went over it when we talked about this chapter, that at this time, I cannot perform this service on you because there is a skin condition or concern that I see that makes it to where I will not be able to give you this service. And once that resolves itself, then you can come back and we'll give you this service. I'm not allowed to tell them that they have lice. I'm not allowed to tell them that they have rosacea. I am not a doctor. I did not go to school for 7 years. I cannot say that. I can just recommend them to see their health professional. In this section, it goes specifically over a bunch of your eye diseases and disorders such as blepharitis, conjunctivitis, contact dermatitis. So not only do you need to worry about the diseases of the eye, but of the surrounding skin as well, because again, even if you're only working with one area, the rest of it is also affected. What is a corneal abrasion? How is that different from a corneal ulcer? What is ocular herpes? Can ocular herpes be treated? What happens if somebody comes in with one of those conditions? Common skin conditions that will also fall under this, because even though we're eyelash professionals, we do still work on the human body, which has skin. So the difference between a papule, a pustule, vesicles, those types of things, lentigens versus a macule. And again, most of this should be a review for you guys. So that's why I'm not going super in depth on what all of these are. And why I went more in depth with this one is because this is new information, whereas this chapter that I'm going over is a chapter you guys have already done. One of the major ones that is important to know is the malignant skin conditions. These are skin cancers. So again, as well as knowing on a rough basis what all the skin conditions and disorders are, mainly following the ones that are around your eye. But again, general rule and always a good note is to know your skin cancers. So we have the basal cell carcinoma. This is caused by UV or sun exposure. It is most often benign, and as of 2021, it is the most common form of skin cancer. Squamous cell carcinoma is an aggressive growth that generally affects clients over the age of 60 and is caused by sun exposure and is twice as common in men, and it has the potential to spread. Basal cell carcinoma can spread, but spreads very, very slowly, whereas squamous cell carcinoma spreads a lot faster. The next one we have is malignant melanoma. This is an increase in cases due to our obsession with tanning, but it is a type of skin cancer that develops from a pigment-producing cell, those melanin cells that we learned about when we were learning about the skin earlier, known as melanocytes. It is a common site for legs on women and for the backs on men, because those are the most common areas to get sun. And it can occur from an existing mole, so they should be checked on a regular basis, for irregular pigmentation, changes in color or size. And again, so you want to remember your A, B, C, D, E's, which is A for asymmetrical, B for your border, C for color, D for diameter, and E for evolving. And that is how you tell whether or not it is cancerous or something that you should be concerned about. But again, you'll also have to learn the normal differences between vascular diseases of the skin versus a gland disorder, whether it's of the subcutaneous gland, which is your sweat gland, or your sudoriferous gland, which is your squamous subcutaneous gland. I'm messing up a lot. Okay. The sudoriferous gland is your sweat gland, and your sebaceous gland is your oil gland. See how everybody can get confused? So make sure you know the difference on which one is which and what conditions that they can actually cause. Certain conditions can be caused specifically by bacteria. So those can be like boils, carbuncles, which is a group of boils, impetigo, which is a very contagious condition, size, as well as pericardia, which is a bacterial infection of the tissue of the nail wall surrounding the nail, inflammation resulting in swelling, redness, or pus occurs, and the client should be referred to their doctor for treatment. Figuring out what a fungal infection is, which will be your ringworm, your athlete's foot, which is Tinea pedis, versus Tinea corpus, Tinea capitis, which is ringworm in your head, Tinea unium, which is ringworm of your nails. So it's just all the different forms of fungus and where it applies. So if it's capitis, it means your head. Pedis, anytime you hear pedi, it means your foot. So think of like a pedicure. That way you can kind of think of easier ways to remember those harder medical type terms. Viral infections, these ones will be your warts, cold sores, herpes, hepatitis, those types of conditions. This section also has some other ones that are important to be aware of. So go back and read through that chapter. But again, it should be mainly review. Chapter 8, which is your protocols and procedures chapter. So this is figuring out when you can and cannot give a service and how to actually give those services. So it tells you how to apply classic eyelash extensions, things like that. But the thing that we mainly want from this chapter is one, the end, how it will always go through how to take care of whatever service you're doing, the tweezers, things like that. And then as well as on page 98 of your textbook, this one goes specifically over patch tests, which is, again, one of those sections that we see on this written. So a patch test needs to be carried out before any treatment takes place. Your client needs to have a patch test done at least 24 to 48 hours prior to a treatment taking place if they've never had that treatment done before. If they've had it done, obviously they don't need to constantly have this patch test done. This is to identify if your client has any sensitivity / allergic reaction to any of the products used. Treatment cannot be carried out if there is any adverse reaction. So if there's any redness, irritation, if they start getting any of those acneic lesions that we were talking about earlier, any form of reaction means that they cannot get a service. If a client has an adverse reaction to treatment and did not have a patch test, you could be held responsible, which could be costly and damaging to your reputation, but mainly the fact that they can sue you. So the patch test procedure. Step 1 is to clean the area of the skin to be tested, usually behind the ear or the crease of the arm. You want to pick skin that is closest to where you're applying it. So the behind the ear is a better place to place the patch test than the inside of your arm, because that skin is a little bit farther away and a little bit more different than the skin that is on your face or head, as we learned in the skin chapters before. So trying to do it behind the ear. If for some reason you can't do it behind the ear, then the inside of the arm. You want to do it in a not noticeable area in case there is an adverse reaction, that you won't have any adverse reaction on somewhere that is easily seen by people and cannot be covered up. So we'll apply a small amount of the lash product to the area, such as your adhesive, your lash tapes, whatever you think is going to cause that concern. You will allow it to dry and then advise your client to leave it on the skin for 24 hours. If there's no reaction, then they'll wash it off. And then if an adverse reaction happens, red, itchy, or the sore area, the product should be removed immediately with water, and a cool, soothing lotion should be applied, such as aloe vera, to help minimize the negative reaction from that. So think green light, red light. Green light is a positive reaction. So positive reaction means that there's nothing at all that you have to worry about and you can treat. If they have a negative reaction, if they're sore, red, or itchy, that is the stop of do not treat them. And again, that is on page 87 of your guys' textbooks. So that went over chapter 6, your safety and infection, chapter 7, diseases and disorders, and then chapter 8 of that patch test and blood exposure incidents that were already covered in your TELR book. If you guys have any questions about your written exam or your practical exam, feel free to ask any of your instructors. Go through those chapters, study those chapters, make Quizlets. There's already some on Quizlet. There's YouTube videos of just hundreds of PSI questions that you can look up as well. Try and get as many different ways of studying and find which way that works best for you and study with that. And then we'll be able to figure out how we can best help you study for that exam. If you guys don't have any questions that you need to email one of your instructors or anything, I will see you next time. Bye.